Hello and welcome back to On Air with Dr. Pete. I'm your host, Dr. Pete Economo, and I hope you're all having a great week. I'm excited for today's guest as a good friend as we go into May Mental Health Awareness Month. So we are bringing you important topics related to mental health. This is my friend and colleague, Dr. Jason Krystofiak. He serves as one of the team physicians for Rutgers Athletics, and he is the team physician for the football team there at Rutgers University. He's also the chief of sports medicine for Cooperman Barnabas Medical Center and a clinical professor of family medicine and community health. So we work together at Rutgers, and he's heavily involved in the education of medical students. He's a published author on NCAA research and is considered an expert in concussion management. Thank you for being here, Dr. Krystofiak.
Dr. Pete, always a pleasure. Thanks for having me.
So this is going to be fun today. So, I mean, not that concussion and mental health is fun, but we're going to talk about, so do you remember when we first met?
Yeah, 2018. I think 2018.
Yeah. Yeah, that's when I came to Rutgers. But you had already been there. So tell about your journey of, you're like a real Rutgers person.
Yeah, so I actually, I graduated undergraduate from Rutgers.
Yeah.
So that was easy. This is going back in the day when they had the grease trucks, and I could talk about the 3,000 calorie sandwiches I would have at late night studying for organic chemistry and such.
Uh-huh. Did you know you wanted to be a doctor then?
No, I didn't.
Oh.
I changed my path after my mom passed away from non-Hodgkin's lymphoma. I wanted to be a race car driver, oddly enough. Clearly, that was not going to happen, right? Just you have to be realistic with your goals.
That is so cool, though.
Yeah. But yeah, so undergrad at Rutgers. So I was always bleeding, Scarlet Knights, and went to medical school. Was able to come back. Was able to go to residency at RWJMS at New Brunswick, which was my dream top program.
Nice.
And then I stayed on for sports medicine fellowship at the same institution, which is great.
Yeah, so 2018, because that's when I first got there. So that makes it's about right. But I only came to athletics in 2020, and I'll never forget that because it was December 19 into January 2020.
Oh, now we're talking about COVID.
Yes. So we were like on the sidelines of games and football and just us.
Yes.
That first season, you were really instrumental in that, of course, with the chief medical officer, but making sure that the athletes were safe and really ahead of the curve on a lot of the science of COVID and the health of our athletes.
Yeah, it was a really trying time. It's a great testament to the teamwork. At Rutgers University very specifically the sports medicine, but everyone really just working together, developing protocols and new policies. We were doing things somewhat different. And it was to the benefit of the athletes. And I think everyone appreciated that. And we get feedback about that still, which is great. It's a tiring, very traumatic time.
Totally.
But the bonds that were created during that time are special and lifelong.
Yeah, they'll stay there forever. One of the things I love about the podcast, Jason, is I'll have some friends on like you, and you learn stuff. So I have to go back to this race car driver.
Yeah, it's probably because I was a really big Danica Patrick fan.
Okay. If you're watching on YouTube, you'll see the shame in his face. Yeah, so that's where it started.
Yeah, it just was into Indy cars, and it was something different. It was something different. Traveling to go to races.
So did you go to watch, or would you also race?
No, just go to watch.
Okay.
Just go to watch.
I had a client once who part of his midlife crisis was racing cars. They do have tracks where you can get cars to race as learn how to. Do you know that?
Yeah, no, I did a little bit of that.
Okay.
It's a lot harder than it looks. So
yeah,
it's a lot harder than it looks. Put yourself in one of those Indy cars, the amount of G forces around a turn.
No.
There's been, we're talking about athletes today, right?
Yeah.
It's so interesting. So people would say I don't know if race car drivers are athletes. They just sit there and kind of just go around in circles. I'm like, whoa.
Yeah.
Those men and women are very, very fit athletes for what they have to do in that car. So
like core and things like that.
Oh, core, their neck.
Yeah.
For that, and just their ability to just hold the wheel with all those G forces.
Wait, good segue. Neck. How is the neck involved? Because I'm also wondering, with race cars, and then recently, as we're recording this, there was that boat accident. They were trying to beat the world record for the fastest boat on water. Did you see that? It was like
I
they were trying to
did.
go over 200 miles an hour or whatever the number is. And so there
Yeah.
must be concussions in this too. I'm thinking.
Absolutely.
Yeah.
Unfortunately, there's concussions everywhere. But
Yeah.
in the motor vehicle, the racing
Mm.
scene, there's for sure concussions.
Yeah.
And as a part of their training, they do full body, but core, upper body, and neck are really instrumental, just because you have to have the strength to be able to sit there and be able to maintain these forces, or you pass out. If you ever see people go
Yeah.
up in the fighter jets and they get
Yeah.
those G forces and they just pass out, they're
Yeah.
not trained for it. See, these guys train every single day.
Yeah, they make movies on that too, where they have these. I've seen they're training them not to pass out, but it's the mental resilience and mental toughness it takes to do those sports is pretty instrumental. Yeah,
Absolutely.
yeah. And so you've always been great to work with, and what made you kind of think about like mental health in the treatment of concussion, or just did you see in the athletes you were treating that there was like what did you notice that we were like, hey, I'm glad we have like sports psychology to help us with this.
Yeah. So, going back, and obviously we've worked together so much, how transparent I am, probably sometimes to a fault.
Yeah.
Going back years, I caught myself not optimizing the care because I was overlooking the behavioral health aspect of it.
Mm.
A lot of these individuals either had some form of baseline depression, anxiety, sometimes even bipolar,
Yeah.
other comorbidities like ADHD.
Yes.
And I just initially wasn't factoring that in to the best that I could into their management plan. And I always looked at concussion management individually as pillars. So I would look at, okay, there's going to be the cardiovascular aspect. So I'm going to exert them in a safe manner without putting them at risk for repeat injury. And then, or I'm saying, hey, there's a neck component. So there's a cervicogenic component.
Yeah.
Or there is a nutritional component with regards to how we would maybe optimize their oral intake of food and fluids after an event happened.
Yeah.
But then the behavioral health aspect, someone will say, oh, I feel really bad about myself. Oh, it's a part of the concussion spectrum. You'll be fine. Once you're better, you'll be fine. Starting to realize that by tackling that early on, these individuals are having acute stress reactions.
Yeah.
Acute reactions that may not be their baseline, or could be their baseline that got worse, or an unresolved issue, or PTSD.
Yes.
And that, hey, how am I going to get back to sport at the same level if I'm afraid of getting my head hit again?
Totally. Yeah.
So it's just once I started incorporating that in and utilizing your resources along with your amazing team, all of a sudden I'm noticing that not only are people getting better faster, they're getting better with more confidence. And that sport confidence, even with musculoskeletal injuries we see, can really, really affect someone, where you have someone who may have torn their ACL, and from a strength and conditioning standpoint, from a physical therapy rehab provider standpoint, you can mark off all the check boxes. They're 100% ready to go, but they're just not performing the way they used to.
Right.
It's possibly a sport performance issue coming from behavioral health.
Yeah.
And obviously, you work with these athletes in these post-injury spectrum. So there's no difference whether you're tearing your ACL or you're getting a mild traumatic brain injury. It is an injury that can prevent you from playing sport, and that's a misnomer, right? We always use the word return to play.
Yeah.
Obviously, for concussion, so challenging to give a return to play. We can give some ranges, but often they're so individual.
Yeah.
With ACL, it's like, okay, you're going to be back within 9 months, for example.
Right.
Well, there's actually people who tear their ACL who never play sport again.
Right.
So these are just things to really think about and implement.
I think that's so hard as a physician, because people want those answers. Like they really want so much from y'all, and especially at high level performers where they're like, I need to know, is it 6 months? Is it 5 months? And, you and I know that, and it's hard. I mean, my dog was given 3 to 6 months to live 2 years ago, like I hate to bring a dog in, but that's what I do. If you listen,
I know very well about your dog, and
You've heard.
What? Good for your dog.
She is just going.
I hope it just keeps on going.
Yeah. Well, like you said, all things come to an end though at some point. But so if what I was just thinking when you were talking there is like parents listening to this, because I think that concussion is so scary for a lot of parents, and then to hear that the mental health component is there. What would you say to parents, or you even as a parent, like what would you say about concussion because I think it's gotten, you and I have talked about this, sensationalized in the media. So what would your advice be, or how would you educate parents on this?
I try to be as neutral as possible,
Yeah.
but there's always going to be that undertone with me saying, if I truly believe, based on all the available information, your son or daughter is going to be fine.
Mm-hmm.
At some point, this is going to be in their past. They're going to be fully resolved, and they're going to be able to continue on doing whatever they love to do, whether that's a contact sport or a non-contact sport, or not even a sport, whatever the case may be. There's a level of confidence I can have that conversation with. Now, if someone's seeing me that's had 6, 7 concussions,
Yeah.
my counseling might be different, right?
Right.
What I'm saying might be different. But for someone who's had 1 or 2, I can give that confidence. But I say, your son or daughter is going to be just fine if we follow these steps.
Mm-hmm.
And I go through these pillars I kind of alluded to before, and I include, because as a part of the questions that we ask are extensive in behavioral health and mental health, and making sure that we are not missing anything. That's like one of the worst things. They come in for concussion management, and we focus so much on that word concussion.
Yeah.
Like, we're going to give you active recovery. We're going to give you eye exercises. You're going to take melatonin for sleep. We're going to give you meloxicam for your night, whatever the case may be. And then they're like, hey, I have a history of depression. I'm not really feeling the best right now about that.
Mm-hmm.
But then we totally just gloss over it.
Right.
It's a missed opportunity to optimize that care and potentially to fix a problem before it becomes even more of a problem. So I'm very candid with the parents that I'm making sure that we're tackling all aspects of it. We're counseling on all aspects of it. And if they're not plugged in to an individual like yourself, then I'm using that encounter to say that there is no shame. There is no questions. There is no questions that we can't answer as long as we're being very transparent and honest with each other. If this is something you're concerned about, we can tackle it.
It's interesting that you say that, because the NCAA data recently reported that mental health concerns are about 2 times higher in the last 5 years. And so less than 40% of those actually feel comfortable seeking mental health, support. And so being May is Mental Health Awareness Month. Like, why do you feel, from your perspective as a physician who specializes in concussion management, that there's been this uptick in mental health concerns? Do you think, why do you think, what do you see happening?
It's interesting on the ground. I think people are being more open about it, and complete conjecture. COVID allowed a lot of people to reset, right? Obviously, a lot of individuals had very poor outcomes, unfortunately, because of that.
Right.
But a lot of people were able to reset, have more time to think about these things and say, where are we?
Yeah.
Where is our behavioral health program compared to other people nationally?
Mm-hmm.
Right. That awareness, I think, automatically allowed people to have safer conversations with individuals that they typically wouldn't have.
Mm-hmm.
More trusting relationship. You know how this is. When someone comes to see me and they use it as it's personal, we kind of assume what that could mean.
Right.
But if they don't trust you, they're not going to open up and say, you know what? I am not okay.
Yep.
The anxiety is through the roof. I have these stressors. I need someone to help me. That is a big step. And if there's not trust, they're not going to have that conversation. So I think providers are becoming a little bit more human, not robotic, right?
Well,
we're not robotic. Right? You can tell when people are watching, we're not robotic people.
Yeah.
But there are robotic providers. And I don't know. I'm not going to want to talk to that robotic provider, right?
Well, hasn't med school changed where they're like taking more liberal arts people that they're admitting into med school for that reason?
Exactly.
Yeah.
And they're using this. I was talking to a medical student.
Yeah.
I was kind of giving him some hard time. I'm like, when I took the boards, I used to get a number grade. Step 1, you're not getting a grade anymore.
Yeah.
You're not getting a number. You're getting a pass fail.
Wow.
And I'm like, well, I remember when I took my Step 2 CS.
Mm-hmm.
Man, that was interesting.
What's that for people, for listeners? What's Step 2 CS?
So you would go in as a medical student, and you would be observed through video camera or through the actual actor themselves.
Yeah.
In a medical scenario where you were taking a history, doing a brief exam, coming up with a plan. Behavioral health was involved in that, going through a potential suicidal ideation I remember I had for my Step 2 CS.
Yeah.
You're interacting. How normal are you to be able to have these conversations with somebody?
Right. Just to have like a regular.
And because of COVID, here comes COVID again. They actually put it on temporary hold, and they transitioned out of it. Now they're doing some more stuff online, as well as do their distal step exams.
And like in a time that we need it more than ever, probably like that whole interpersonal connection, because I do think post-COVID, people have lost the ability to have difficult conversations, to be uncomfortable, and to have, just to talk.
Yeah. Again, this is the human aspect of it. There's times where I think I even said this to you, like, you know what, man, that encounter was not good. Like that was not the best version of myself.
Right.
Talking to that individual. Yeah. And I really wish I had that back, but I'm very transparent and honest with the patient in that moment where I say, you know what? I just said that. You know what? I'm going to go back in time a little. Let's do some Back to the Future.
Right.
Let's reset the conversation because that does not make sense.
Now, I understood that reference, but if anyone who knows Dr. Krystofiak, he'll make lots of movie references, and they don't always. Sometimes we don't always know which movies you're talking about. What's your favorite kind of movies?
Oh man,
it's a tough one.
Well, that's a real tough one. That's going to change based on the season.
Okay.
So I can go from saying Vanilla Sky to Casino to Goodfellas.
Yeah.
To, you know what? I don't have time for movies.
Yeah. Right. Yeah. Because you're too. That's probably during football season.
For context, I put movies and TV on the background and I do my medical notes.
Ah. Okay. So there you go. That's right.
Background.
Yeah. So you've talked about noticing how sports injuries have a long-term effect and can affect like overall quality of life. So why do you think early intervention is so important, when you're first treating an athlete?
It's again, trying to tackle all aspects that you can handle. So their return to play is as safe and efficient as possible.
Yeah.
When you rush because you see this is an injury and I say, oh, this is an injury that I'm going to do a PRP injection, a platelet-rich plasma, or whatever injection therapy we can offer. Mm-hmm. Let's not get tunnel vision. Right. If we're picking up on the fact that they're not doing well, they're having signs of early PTSD from this injury.
Right.
They're feeling anxious about this injury because now this injury is now keeping them from playing.
Right.
What does that mean? Does that mean the number 2 or the 3rd or 4th individual, whatever the case may be? I always hate to say it that way, but being real and collegiate level athletics.
Yeah.
Does that mean that they're going to get all the playing time? And what if I don't get back to, what does that mean?
Right.
There's so many questions. So we're really trying to look at all these injuries holistically and saying, how can we optimize this individual's health from all aspects?
Yeah.
And do it right from the beginning and not play catch up. Because then you're 5 weeks in, you're getting someone back from a hamstring, and now there's a sport confidence issue or there's untreated anxiety, whatever the case may be. There is no reason from a holistic standpoint we can't tackle all this right from the beginning. And
you work with also professional athletes too, and so that's important to recognize. So you see it at all levels. High school. I know at Cooperman Barnabas, right? You see a lot of high school athletes there as well.
Yeah, a lot of high school athletes that we see through our amazing partnerships that we have. We do take care of Gotham FC, the women's professional soccer team. So I'm actually their chief medical officer, and I am so lucky to have a gifted team of physicians: Dr. Peter DeLuca, Dr. Tuminelli, Dr. Gabby Guzman, right, from your side. We're really put together a fantastic team to take care of these elite athletes. Yeah. And they are so cool, calm, and collective that you lose sight that they just won gold medal. So there's a lot of athletes on Gotham that have gold medal because they're on the U.S. national team.
Right.
So they're in the Olympics. They win. They come back with a gold medal, and you said, "Wow, I take care of them. Yeah. Lucky me." But how awesome is it that you allow me to take care of you?
Yeah.
Right. That is so cool.
It's a gift.
It's a gift. It really is.
Yeah. Well, yeah.
But there's so many physicians. New Jersey is so dense, right?
Very.
There's a lot of options in New Jersey. Yeah. So it really is an honor when you look at that grand scope, when you get to say that you're taking care of one of the best female soccer athletes in the world.
Yeah. And the NASW is really focused on mental health. I think that's important for listeners to understand that a lot of the things that Jason and I work on, consulting with these other organizations and professional leagues is about the integration of sport medicine, sports psychology, behavioral health. It's so critical. And a lot of these leagues, MLS, NASW, they're really, putting a lot of resources into that. All right. So going back to physical. Again, because listeners, like, you realize that the connection is physical injury yields mental health challenges. And so it's important to have a whole team of people We're just like one of the other coaches there. But it is helpful. I always say my job's to not have a job, and that would be good for you too, right? Like in these contact sports you work in, it'd be good if people did not get hurt. Impossible, but at least reducing injury to optimize performance. So what are some good habits for people that are trying to say reduce injury or optimize performance?
Yeah, that is such an excellent question. And we do focus a lot on prevention.
Right.
And we do have that conversation where we say, I would love to be on the sideline of a game. And this is now a debatable concept, right?
Okay.
Can the team physician, a team physician, or the head team physician be a fan at the same time? My answer is unequivocally yes.
My answer is no, but go ahead.
Which is great to debate about.
It is, yeah.
But hey, I just want to be there and be present and be available,
yeah,
and not have a single injury.
Right.
That's amazing.
If only.
If only.
Yeah.
Unlikely, but if only.
So how do we prevent them?
So we look at all aspects of whatever that sport is, and a lot of the time it really boils down to just good sport technique as just one thing to tackle. There are individuals that are so gifted and talented, but they just have no control of their bodies. They fly over the field, whatever the sport is. They're just flying around. They're putting themselves at risk. So good sport technique is always good. Making sure you're listening to your strength and conditioning coaches to make sure that you're doing an appropriate level of strength and condition and you're not overdoing it. Looking at what you're doing as an individual and making sure that if you're doing 2-a-days, for example, 2-a-days are not allowed, and collegiate boats, forgetting about collegiate, other areas, people are doing 2-a-days.
Yeah.
Now all of a sudden they go home, they do now a third practice on their own because that's what they think they need to do.
Yeah.
It's just too much. You have to just be really realistic.
So overtraining.
It's overtraining.
Yeah.
You can't overtrain. You got to be conscious of your recovery, and what you need to recover. So good sport technique, allowing your body to recover, not overdoing it. There's programs that are designed, such as FIFA 11 for different injuries, but for very specifically for concussion, I really have bought into neck strengthening.
Okay.
Making sure that there's a nice stable.
Is that provocative when you say that way? Like you bought in? Like, is there people out there that are going to say no? It has nothing to do with it.
I think 100% there's going to be people that are going to disagree with it. Okay. But this is not very taboo. It's so your structure, right? Your head sits on. It makes sense
to me.
It sits on your neck. You have a weak neck. You're going to move around a lot.
Boom.
Moving around a lot is going to cause the brain to move around a lot.
Right.
So if there's forces that are being directed up to your brain, that we can maybe minimize a little bit because of you having a stronger neck.
Right.
I'm seeing it in the literature. It's coming out. I mean, people are studying it, and people really, really believe in it. And I have yet to find a reason where if you do strengthen your neck and it does nothing to prevent concussion, I have not heard it hurting you.
Right. It's like there's no adverse effects of having a stronger neck. I have
not heard of an adverse effect because of it.
Right. Yeah.
So, neck strengthening is something. Staying hydrated.
Yeah.
Another key, like getting good sleep. These are all part of your recovery. Hydration, sleep, good sport technique, good range of motion and strength of your neck. I have personally seen it be really helpful. I'm hoping research will support it.
So those are really good tips for people. So as we're getting ready to wrap up already, what changes have you seen in sports medicine landscape in general over the last decade?
So a lot of data analytics. I think there's pros and cons of that.
Sure.
Because we want to make sure that the data that we're using to give advice to our athletes and our non-athletes alike is coming from good sources and meaningful.
Yeah.
So sometimes too much data can muddy the water and can cloud.
Agreed.
What is the exact issue that we're dealing with?
Right.
So I think data analytics has been a big part of it. But the one thing that I've seen is this actually more teamwork approach.
Yes.
Where it's a marriage between the athletic trainers, the physical therapists, the behavioral health providers, the medical doctors, the coaches, the strength and conditioning. Everyone is now coming together as a team, as a sports health team, to be able to care for the athlete with one goal in keeping the athlete as safe as possible. And when they do get injured, making sure they get back to doing what they love as soon as safe as possible. Before, it seemed a little disjointed. I'm even going back to when I was in fellowship. great program, great everyone individually, but then that's fantastic individually. We were missing things from a teamwork standpoint. And I think going back from we met in 2018, Pete, to now, we've seen it. We've seen the benefit of being cohesive as programs. And I just don't think there's anything that's going to separate that. And I think we're getting good feedback from the athletes where they're seeing it, where there's actually good communication passing amongst the subspecialties, and they're seeing a benefit in their care.
Yeah, and so just working together as a team, us as the providers as a team. So if there's anyone listening, Dr. Krystofiak, what's like one piece of advice you'd give, say, for like an incoming college athlete who's about to start this journey?
So know who the players are. When I say players, that doesn't mean just you and your teammates. Physically know who's taking care of you. There's times where people can go up to one of the athletic trainers for football and say, "Hey doc, what's going on?" And they're like, "I'm not the doctor." And it's just like, "Oh, well, you've been here for 6 months. How do you not know who's who yet?" So right off the bat, who is taking care of you, know them well. And develop a relationship with them, because that relationship is going to be really important. And just be as transparent as you feel comfortable with. The people that are around, they will be available to you in most cases 24/7, and they will do whatever it takes to help you. If you will open the door a little bit and make sure that you are being as transparent as possible, because without all the information, it's sometimes really challenging for any medical provider, no matter what specialty it is, to be able to help. So, hey, be an open book, know who's taking care of you, and have fun.
Yeah, that's good advice.
Please have fun.
That's good advice. We have fun, right? You and I have fun. We have to.
We have so much fun.
All of us have to have fun. So where can people find you? I know you have many different practices. So if you Google Jason Krystofiak, who knows what you'll find, but where would you direct them to find you?
That's an amazing question. So again, very transparent. We are not the best with marketing our sports medicine services at RWJ Barnabas Health. But if you search Jason Krystofiak, MD, and RWJ Barnabas Health or RWJBH, there's a main profile of mine that you can go to. It has my contact information. It has who I am. And there's some other helpful information on the main website as well. But
we're going to have that.
I'm not fancy enough to have my own website yet. Maybe next year.
Maybe next year. Let's get that. But for now, you'll find it in the show notes, whatever your current website is. So thank you, Dr. Krystofiak, for being here. I really appreciate you making the time in your busy schedule. Thank you.
This was a lot of fun. Thanks, Pete.
As we wrap up Mental Health Awareness Month, we're going to keep the conversation going. So just because May is over, that doesn't mean that this stops. We are going to continue the conversations, and we encourage all of you listeners, if you're having any challenges, we have the resources for you. My goal has always been to reduce stigma and make sure that this month's context helps bring more awareness to mental health awareness. So thank you for being here and tuning in. Please like, follow, and share. And you can find everything at officialdrpete.com. And I will see you here next week. Until then, spread a little kindness and stay well.